Can everyone see my screen?
Yes, it looks.
Okay, sounds good. All right, so should I get started or?
One second, let me confirm that it is being live streamed.
Okay, just let me know.
All right.
How long does your webinar last?
Not long. I would say maybe 30, 40 minutes or so.
Sounds good. And it seems like we are live. So hello, everyone. And thank you so much for joining us for another shadowing session with WebCeph X. And today we're joined by Dr. Dongjin Shin, a prosthodontist and a part-time faculty member at Columbia Dental School. So thank you so much for joining us, Dr. Shin. And whenever you're ready, the floor is yours.
All right, sounds good. Thanks for having me today, everyone. So my name is Dr. Dongjin Shin. I'm a prosthodontist currently based in Maryland. I was in New York for a few years during my residency. Recently just relocated to Maryland and currently in process of starting my own practice, which is in the works. I was invited by Dr. Park to speak at your seminar session just to introduce what a prosthodontist is and just explain to you what we do in this specialty. I think this is great that we're doing online sessions for students, especially during these tough times with COVID, because I remember back in the days when I was preparing for school, shadowing the dentist and visiting the doctors and actually speaking to the current practicing dentist was a tremendous help for me in terms of making sure that it's a field that I really want to get into and to prepare myself, my application for the whole dental process. So I know it's a very stressful times for the students to prepare for dental school. So I hope this helps. I would like to share a little bit of my story so I will just explain a little bit about me and my journey into dentistry and future plans. And also get into prosthodontist role in dentistry. Back in my dental school even, I really didn't know what a prosthodontist was. So I think this will be a nice presentation for you and also introduce what a prosthodontist does. I'll just share a little bit of my work and also just a little tap into the digital era of dentistry, how the digital workflow has tremendously changed the landscape of dentistry. So I am from Busan, Korea, which is the southern part of Korea. I was born there. At the age of 11, I was in 6th grade. I came to USA to study abroad. So since then, I've been here all along until now. So I went to middle high school, college, and then got into my dental school. So I went to Brandeis University in Boston, Massachusetts. I majored in economics. At that time, I wasn't 100% sure that I wanted to continue in dentistry. So also I was interested in economics, so I majored in economics. And then after making sure that I was certain that I want to continue and pursue my career in dentistry, I went on to Boston University to master in medical sciences, and also at the same time to strengthen my application, which I'll elaborate a little more later in the slides. And then I went to DMD program in Boston University, of course in Boston, Massachusetts, for 4 years. After practicing for about a year as general, I went to a PROS program in Columbia University and currently in full-time private practice and as a part-time clinical faculty in Columbia University, PROS division. So this is just a rough timeline of my timeline. So after studying an undergraduate, which was 4 years, I did my 2 years of graduate studies in medical sciences. I received my master's program. That program specifically was pretty much for DMD applicants and MD applicants. We pretty much took the same medical courses that the MD, dental medical school, students take. We took the anatomy, physiology, all that courses. Also did another year of research, research department. So this was a very, this 2 years really showed my commitment to the dental school application admissions people that I really was devoted into this medical and dental field. After getting into dental school for 4 years, I finished, and then for 1 year general dentistry, I practiced in Boston, Massachusetts. And during that year, I was introduced to prosthodontics, which really triggered my interest, and then pursued my career from then on for 3 years in Colombia. And I currently have been in private practice since 2018. So just to talk about the specialties in dental field, I'm sure other speakers have spoken about this subject. So I'll be just like briefly go over this slide very briefly. The main 6 specialties that everyone is aware of, a lot of people are aware of, or at least the patients hand in hand, are prosthodontics, which I am, periodontics, which specializes in gum and soft tissues, oral surgery, mainly doing a lot of implants and larger surgeries, maxillofacial reconstructive work, and just a little larger scope than periodontics. Endodontics, root canal specialists, and orthodontics, specializing in braces, and pediatrics, treating the kids. There are other specialties on the right side, as you can see here. Let me see. One sec. There's anesthesiology, public health, and maxillofacial pathology, with pathology specializing in any kind of disease and symptoms that's related to not only teeth, but actually the oral health in the terms of soft tissue and anything that's related to the head and neck area. And radiology, oral medicine, and orofacial pain. Orofacial pain deals with just general TMJ or any kind of uncertain pain that we, as other specialists, cannot really diagnose. If the patient is feeling pain and we cannot determine or diagnose where the pain is originating from, that patient is usually referred to orofacial pain, where they diagnose whether it's actually the pain is originating from the nerve itself, or any kind of other larger scope treatment is needed. So total of there's 12 specialties in dental field. So prosthodontist, what's a prosthodontist? We prosthodontists take 3 additional years of advanced training in an accredited program. There's multiple programs in the United States. I'm not exactly sure of how many, but there's quite a few. Not only university-based, but there's PROS programs based in hospital programs also. So we specialize in complex clinical conditions associated with missing or deficient teeth, and or maxillofacial tissues. So we don't specialize only in giving patient teeth, but if they're deficient in bone, or if they're deficient in soft tissues, or any kind of connections from the nasal cavity to the oral, and any kind of functions that's related to the mouth, we specialize and we work with other surgeons to reconstruct any prosthetics for the patients. So we do any pretty much all cosmetics, dental implant, bridges, dentures, and deal with any TMJ or TMD, temporomandibular joints, or temporomandibular disease processes. So we work hand in hand with other specialists. So I like to say, we prosthodontists, you can consider us like a quarterback in terms of team, if you're considering a football. If the patient comes to us, we figure out the final destination, final outcome. I'm sorry, Jen, it's just my baby here. Okay. Yeah. All right, one sec. Yeah, we work hand in hand with other specialists. So we come up first with the plan, and once we have a plan, we designate which area of the treatment, which part of the treatment is done by which specialists. If the patient comes to us, patient needs a denture ultimately. But before we do a denture, if the patient needs any perio treatment, any ortho treatment, or any root canals, we refer out these cases to these specialists, and then ultimately the patient comes to us to finish the job. So I'm going to jump right into case presentation because just seeing this case presentation, it should clarify a lot of this, stuff that I'm talking about right now. So this is a patient of mine who came in asking to fix her smile. As you can, patient has been in a lot of past dental work done, and she just wasn't getting the result that she wanted to. She wasn't getting the smile. She wasn't functioning right or chewing right. As you can see, she's had some breakdown in the posterior teeth, and she's had a lot of work done. So ultimate goal in clinical dentistry as dentist or prosthodontist is to restore the function, also the aesthetics, and also whatever we do has to be maintainable. It has to be maintained. And overall, ultimately, we have to boost and reestablish the confidence and overall health of the patient and the life quality. So ultimately, teeth wears. There's nothing we can do about it over time. Just like we age, teeth age. And the ultimate goal is to minimize the wear of wear and wear of the teeth. So ultimately, so that they can use their dentition for the rest of their lives. So you can see here on the right, everything is breaking down. The patient is collapsing or biting at a lower position. Many missing teeth, and not only teeth, patient is missing a lot of soft tissues too. So she's been to general dentist, and general dentist has been treating here and there, just some quadrant dentistry, because she wasn't getting the comprehensive overall treatment. She just wasn't getting the correct, proper treatment done. So she came to me. When she came to me, I come up with the plan, ultimate plan of what we need to get done, what kind of treatment. Does she need implants? If we're keeping the teeth, do we need root canals and so on? So once we come up with the plan, we send it to oral surgery and endodontics or any other specialties. But in this case, I specifically worked with two specialties, oral surgery and endodontics, who specializes in root canals. And then once those treatments are done, the patient comes back to me to put teeth and finish up with crowns and final ceramic and prosthetic lab works. And then, as you can see on the right side, lower right, that's the ultimate outcome of the final ceramic work. Okay, so there's many routes of us as prosthodontists receiving the patients. Most of the time, the patients come to us, but occasionally general practitioners, or we call GPs, they see a patient, and if it's out of their scope, they tend to refer these patients to us to either work with them or work with other specialists to get this work done. So again, this is a top occlusal view. The bottom, again, a lot of wear, many missing teeth. Teeth have been moved a lot. So ultimately what we do is I work with the oral surgeon for this case. We place implants in missing areas. And during the course of this treatment, the job as a prosthodontist is to actually pretty much help the patient function and maintain throughout the whole process. So we give them a temporary bridge or temporary crown so that the surgeon can remove the temporary bridge, get the surgery done underneath, and just let it heal for a few months. So it's our job as a prosthodontist to maintain and manage this patient throughout the whole treatment. So once the implant is done, it integrates. It takes a few months. This specific case took almost a year to actually be done with the surgical part. Once it's all done, we start the restorative process. As you can see, there's some gold here on teeth and some gold here on implants. So this is where we work with other labs to actually make it. These gold are all custom casted and they're cemented onto the tooth to make more higher tooth structures. And once these teeth are all shaped, which is done by a restorative doctor or prosthodontists, we start with the temporary crowns. We make sure the temporary crowns fit well, it functions well, and also, very importantly, it looks well and the patient's happy with it. And when it's all done, we approve and everything, patient is happy with the temporary crowns and bridges. We make the final ceramic work that's finally cemented onto the teeth, and then the case is done. Okay, so this is before and after. So one thing that I really love, and I'm very thankful that I have my job, is just really, this is a life-changing moment for a lot of the patients, and it's a really emotional step the patient takes. Of course, it's financially a big commitment for them, but it's really an emotional, it's just a life-changing experience, which is really a rewarding job for me as a prosthodontist. And you can clearly see how natural the patient smiles. On the left side, it took nearly 15 or even 30 minutes to get to a patient smile that much. Patient had no confidence to now, yeah, she can't stop smiling. Again, beautiful result. So next, I'm just gonna tap into a little bit of the digital era of dentistry, how digital dentistry has changed the landscape for us. As a prosthodontist, I think digital dentistry just completely changed the whole game. Back in the days, we used to heavily rely on lab technicians to make these crowns by hand, which caused a lot of errors, so much time consuming. Ultimately, we translate to, you know, inefficiencies in terms of business as well. But because the digital dentistry has so evolved so much, all our treatment is so predictable and in many ways easier. So analog, we used to take a manual impression. So manual impression is absolutely important, and digital dentistry ultimately cannot replace the analog method. However, digital dentistry does make a huge difference in terms of communication, communication between us and the lab technicians, and very importantly, us and the patients. When the patients comes to us, there's so much that we can provide for them, but it's really hard to communicate to them, to tell them what we can do for them. Just telling the patient, hey, I can fix your smile, I can put crowns on all your teeth. But it's a very, overwhelming treatment a lot of times for them to accept it. But once we usually use the digital workflow and actually show them what we can do digitally, it's a complete game changer. The patient's acceptance rate hikes, patient confidence level hikes, and in terms of business, also, in order for us to provide dentistry, they have to accept your treatment. So the fact that we can show them what we can do digitally and actually incorporate that into their smile is honestly was a complete game changer for me and my career. So this patient is another brief example of coming to me, hey doc, I want to fix 4 teeth, anterior 4 teeth. Obviously she needs to get something done on the 4 teeth. But as I look at it, there's so much more I can do in terms of posterior teeth. Posterior teeth has some restorations that needed some, replacement, but there was a lot of cosmetic work that I could do for them. Just me simply telling the patient, hey, I can do veneers for you in the back is really not going to sell. But however, when we actually incorporate the digital dentistry and actually show them what I can do for them, as you can see before and after on the right side, this really helps them actually understand what we can do for them and what's capable of to fix her smile with modern dentistry. So once she saw this, she approved the treatment plan. After approving it, we just simply work from this flow, jump into the digital world to plan all of our work where we want our final work to be, and then work from there. As you can see, the 2D image is incorporated with the 3D file of her patient's mouth, and then we start designing it. Again, after designing it, very predictable. The final outcome is based on the initial wax up, the digital wax up that you previously saw on the previous slide. And then the patient's smile is done. As you can see, not only did we fix the anterior 4, we put some selective veneers and some restorative crowns in the posteriority to perfect her smile. This is before on the right side, and after on before on the left, and then after on the right side. Again here. Yep. Before and after. Okay. So that's just pretty much it, actually. Yeah. If anyone has any questions regarding the presentation, we can take time to answer any questions that you may have.
Thank you, Doctor. So
Sure.
we do definitely have questions in the chat, and then we'll just go right ahead. Okay. So in the chat, students ask, how is managing work and family as a prosthodontist?
Oh, okay. I would say, it really depends on how you work out your schedule. But as a dentist overall, I think it's you really can control your time. Depend how you want to break it down. It's definitely not a 9 to 5 hour, but if you want it that way, you can definitely design it and just kind of work it out that way as well.
Thank you so much. Okay, so the next question in the chat says, did age or any health factors impact your approach with the case study you showed us?
Age, in terms of treatment planning?
Yes.
Oh, absolutely, yes. Depending on how extensive it is, depending on how the surgical steps go, that would be largely dictated on the patient. So our ultimate goal is to have our treatment outlast the patient. If the patient is a little, younger patient, and the patient is in 20s, let's say, and their teeth is completely broken down, and if we're estimating that we're putting crowns on, all this work done, if we're estimating the patient needs to do it again later down the road in his life, then we would probably pick on a most conservative approach, even though it is a longer route. But if the patient is in the 80s and it's a very elderly patient, and even though there is a more conservative route, we might choose to take a more shorter and easier route because the patient is in their elderly ages. So it really, age hugely dictates our treatment plan as large cases. Yeah.
So going back to your dental school years, why did you choose to specialize in prosthodontics?
Prosthodontics is really hands-on, and there's a lot of artistic thing that artistic aspect to it. It's really hands-on, and that's really what I liked about dentistry. And also being capable of doing these larger cases, it was just such a rewarding experience. So yeah, I just was very attracted to it, and really something that I'm really passionate about.
Thank you. And what's like the main difference between general dentistry and prosthodontics as like your
I would say prosthodontics has a larger understanding of, I guess, the capability and the management of complex cases. So a previous case that I showed you earlier, the first case, I would say a lot of the general dentists out of dental school probably will be unable to handle a lot of these larger cases. But going into a PROS program and being exposed to these complex cases gives you that confidence to handle it. And these complex cases, once it gets out of hand, it's really, really difficult to get in control. And then so I would say the capability of understanding of materials, working with other specialists, and largely, especially the lab technicians. Ultimately, your lab technicians is someone who makes your crowns and makes your prosthetics. And understanding how their workflow and how to talk to and communicate with them, and which materials to pick, which designs, and just a lot of deeper understanding into dentistry just helps you be capable of doing larger cases.
Thank you, doctor. So another question in the chat says, do you think 1 year you spent working as a general dentist helped strengthen your application for prosthodontic residency?
I'm sorry. So 1 year or so, sorry?
1 year of practicing as a general dentist, do you think that helped you become a better applicant for prosthodontic residency?
Yes and no. Yes and no. Personally, I think it just, let's say from the admissions perspective, I wouldn't say from the admissions perspective, having a work experience doesn't necessarily help with the admissions process. What I think with the admissions from the prost admissions would be, you tend to catch a lot of bad habits working directly out of school. So it could actually be less preferable than someone just fresh out of school. So I want to say it helped with the admissions process, but in terms of my career, I think it helped tremendously. And working as a 1 year general dentist helped me really understand what I want to get from the program. So I knew and understand in depth of what I lacked and what I wanted from the PROS program. If I got into dental PROS program right after dental school, I don't think I would have even figured out what I didn't know or what I wanted to learn. So definitely, I think it was worthwhile for me. But in terms of application process, I would not say it really helped. Yeah.
Thank you.
Sure.
Our next question says, what are your thoughts on corporate dentistry versus private practice? And how did you decide that you wanted to start your own practice?
So it's really how the corporate practice works. I think in terms of choosing the path, even if you're a newly graduate dentist, I think it's important to see the bigger picture of where you want to end up. Corporate dentistry is very limited in terms of doing quality dental work because the resources and a lot of the corporate, it works in the corporate environment. They chase after you to produce a certain amount, and you don't really have control over the type of dentistry that you want to do. So I guess at the same time, it's a good model. You can still do good dentistry in corporate settings. But I think it's ultimately where you want to be later in your career. So if you want to be a practice owner and you want to be owner of a private sector, then you would probably want to take this private route. But I've seen many dentists who's very successful in terms of business as a corporate in the corporate world, where they owned multiple practices, and they're tremendously successful as a businessman, which I think it has a huge merit to that. So I think there's no right answer and wrong answers, but ultimately it's really what you want. So just like this session today, I think this is great that you can talk to me, a prosthodontist, who I chose a path where I'm a little more fine-tuned into clinical dentistry and focus on delivering dentistry that I really want to do. But on the other hand, I think you can talking to other dentists who has a more business mind in terms of their career, most likely they will be leaning towards a corporate world. So yeah, I mean, I think they're both great. They're both great, but definitely has a certain pros and cons to it.
Thank you, doctor. So the next question in the chat says, how closely do you work with the other specialists involved in complex cases like the first case you shared?
I work all the time. I work all the time with other specialists. Dentistry, seems like it's a very small scope, because we just deal with teeth. But at the same time, it's such in depth that you simply cannot know everything. You just simply cannot. And the more you work at it, the more you know that you don't know. So working with other specialists, in my opinion, is not an optional thing. I think it's something mandatory that you have to, or it's such a big liability for you. And whenever I have a case, even though if I'm doing a surgery, I do surgeries too. But if I'm not confident doing it, I will not touch it. It's someone else's health at stake.
So this question actually goes off of the previous one.
Mhm.
You as a prosthodontist, do you provide direction and request other specialists to perform a specific procedure?
I consult them. I don't direct them, but rather I set the route for them. So I tell them so ultimately my goal as a prosthodontist is what I need to give the proper prosthetic for the patient. Let's say if the patient needs 4 implants or denture, and I need 4 implants to do it, then I would ask the doctor, hey, I want to not tell the surgeon, hey, place 4 implants here, there, but rather I would ask, hey, I need 4 implants. Can you do 4 implants? And if you can do 4 implants, where you can place it. So, so I work with them and I consult them and then, ask them what I need for me to finish the job. And then they will tell me, hey, I cannot do that, or I cannot do it here, but or they'll tell me, in order to do that, we'll need some bone grafting. We'll have to make the bone larger. And it's on and off. So if it's a bone, if we're growing the bone, they'll say, hey, I need 6 months. And then during the 6 months, it's my job to come up with the template the patient can use. So it's a teamwork rather than me telling them what to do. Yeah. So a prosthodontist is someone who starts with a plan, who plans out the end goal, but the whole process of the middle ground is worked as a teamwork. Yeah.
Thank you.
Sure.
Okay, so our next question asks, from your experience in admissions, what are some common mistakes to avoid in your dental school application?
I think you really need to be honest about, and I think the essay is a huge part. And I think I've seen a lot of writing, like, being a little generic, I think, but rather being just, exposing and just kind of telling them if you're passionate about dentistry, just honest, and you're talking from your experience, I think is the best thing, first of all. So these shadowing sessions, I think is a huge help. I wasn't, I shadowed a little bit, but I personally did not shadow much. But now looking back, if I would do the whole process again, I think shadowing and writing about those shadowing and knowing about the specialties, prosthodontics, whether it's periodontics, and kind of communicating that about your learned experiences from these sharing experiences, I think it could be very, very helpful. Yeah.
So Dr. Shin, you're also a part-time faculty at Columbia. So how do you
Yes.
manage practicing and also like being a faculty, and what does your day look like when you're like at Columbia?
So I'm a clinical faculty, which means I'm only on clinical settings to help students manage cases. And also I give occasional lectures to the students regarding my cases and so on. So it's a part-time, so I'm there half day a week, and pretty much I'm a full-time private practitioner, and just designate either a day or half a day at school. So yeah, pretty much what I do there is just share my experiences in private settings. And my case is just like the ones that you've seen today. I try to take all my photos of all my work. And also, I share it on the Instagram as seen here, but some of the selected cases. But as a student, seeing these cases is a huge help. So that's what I do.
Thank you.
Sure.
Our next question is, so when attending Columbia University Dental School, what was the best part and what makes Columbia University Dental School special?
Best part is, it's a constant learning process. I'm consistently learning every day, and dentistry is consistently changing. So being in an academic setting, I think it just exposes myself to, keep myself as a student, learn from other faculties there, talking to them, or new technologies and so on. So I think that's mainly the part of why I try to be put a foot into academics. And what was the second question?
So what
Second part of it.
what differentiates Columbia University from other?
And Columbia, I think every school has its pros and cons. So what difference Columbia? What's special about it? Back in the days when I was in school, I didn't think it's so special, but I think the strongest part in Columbia, as I look back, is the colleagues that I have. So the way it works is you work hand in hand with other specialties. So I was a pros, and we work hand in hand with periodontists, oral surgery, and the guys that I met from school are actually the specialists that I work still now. So I think that's the biggest thing that I've got. And in terms of deciding which school you go to and what strength they have, is that each school has its strengths. So Columbia has a very strong strength in implant education. So as a prosthodontist, I was very interested in implant surgeries. So I was very much exposed to implant. And so that's the very huge strength of implant. While other pros programs, they don't do much implant education. So that's, pros and cons. But at the same time, even though they might be weak in, implant, they're hugely stronger or heavily educating in classic pros work, lab work and all of that. So it's definitely worth it to look into what each school has to offer. Yeah, so you got to know what you want as you apply and do your research and so on, talk to people. So if you're interested in Columbia, talking to someone like me would be a tremendous help, but you will get a very biased opinion, I would say. Yeah.
So how competitive would you say are prosthodontic residency programs?
I think it's becoming more competitive. Honestly, I don't think it's as competitive as other specialties. I think one of the most competitive, from my experience, is endodontics. Endodontics is very competitive. But pros, I think, is gradually becoming more attractive. Before, it was not. It was not. And as you can see from historically, the average earning potential for a prosthodontist was not as, not even stronger than a general dentist. But games has changed. Again, the last part I showed you, the digital dentistry, and the number of work or number of treatments that we provide to the patient has just skyrocketed. It's just changed so much that the scope of prosthodontics is completely different than before. So so that's what, yeah, it's making it more competitive. And I think this era is huge. So it's great time for prosthodontists. So yes, it is quite competitive. I don't know what number or percentage does get in, but if you're interested in prosthodontics and pros programs, it's a very personal admissions process. So unlike dental schools, which has 100 students, they can't even remember the names who applied, right? 110, 150 students. It's a huge application process. But pros programs, one program maybe has 4 residents. A big program maybe has 7, 8 students. Some smaller one has 1 or 2 students. So it's a very personal process, admissions process. So if you apply, they know your name. If you go see them, they know your face and they know you personally. So it's a whole different admissions process. So if you get to know them and kind of really personally communicate with them about your passion as a prosthodontics, you're more likely to get in than other residents, other applicants. Okay.
So in the chat, we have 2 questions from Dr. Park, if you can see them.
In the chat, I don't see the chat. How do you see the chat?
It's, if you exit out of full screen.
Oh.
Or I can just translate it, but it's kind of hard, so I'll just do my best. Okay, so regarding digital dentistry, he agrees that oral and maxillofacial surgery part also uses this 3D program, scanners, and printer skills. And he was wondering which digital program that you were using, and probably maybe the price. And do you
Price
also
of the,
yeah,
which program and the price?
And does the program design like the implants and print the, what do you call it, implants?
Print the implants. Okay, I think I know what it's asking. So the software that I use is exocad. So most of the digital designing software is based on exocad. There's Zirconzon, so other softwares are a lot of times based on exocad, which is the parent software. Another type of software is 3Shape, which I also am partly accustomed to, but most of the designs that I'm very more prone to use exocad. And the designing themselves are a lot of times done by my technicians. I am familiar and I do have the software, but I am not that savvy or quick with the designing process. The technicians can do it much, much faster than me and much better than me. So I rely on them to do it. The price. The price really differs on how what functions you need. So basic price, it could range from a few thousand to over $10,000 for the software, depending on which software. exocad could have an annual update if you're going to update it every year. But if you decide not to update it, just use it, which is okay. There's no extra monthly fees or yearly fees on top of that. On the other hand, some software like 3Shape, incurs, you can't just buy the software. You have to buy the scanner at the same time together. There's monthly fees occur to it. So the fee structure is a little different for each software. And can it print implants? So if you're referring to the implant surgical guides, absolutely. It can print implant surgical guides. It can, the image that I showed you here, let me see here. Can you see my screen?
Yeah.
these temporaries are all printed. So, or they're milled. They're milled. So it can be milled or printed. But once the design is done in the software, it can be milled or printed however you want to. And also, if you see these gold abutments on the top, on the implants, they're milled from the design. So you can design it however you want to, the length. So all of this is, designed. So that the green part is designed, and within the software, you can change the opacities to make, see how thick it is, and you can bring it multiple files to merge with each other. It's just, there's you can do creative things here. So that's why this is great. Mm-hmm.
So you mentioning digital dentistry towards the end of the presentation was really eye-opening. Mm-hmm. So I do have a question regarding this. And
sure.
How accurate are these softwares? Like, do they account for, I guess, unexpected side effects that may occur?
It's accurate as the impressions. So inaccuracies, the design and the software itself is super, super accurate. Okay, and there's, many studies have been done regarding its accuracies, and it's confirmed it's very accurate. Now, there are some errors and room for errors where the digital file is translated into the solid model, whether it's printed. And during that process of converting back and forth from digital world to the analog world, that's where a lot of the errors occurs. So that's why analog method, as I said, cannot be replaced with digital dentistry, at least yet. So, that's where most of the errors occur. But digital software and itself, software is very accurate.
So we have our last question in
Sure.
the chat, and Caleb asks, is there a dental specialty that you prefer to work with more than other prosthodontists?
Is there other specialties that I prefer to work with than other prosthodontists? So since I'm a prosthodontist, I work a lot with surgeons and endodontists. And regarding the surgeons, there's not a specific specialty I prefer over the other, but definitely depending on the type of cases, I would work with a certain specialty. So, there's a lot of other complex cases. If I would have time or have a different session, I would love to, I could share with you, but depending on the scope, if it's a larger scope, let's say patient had a mandibular fracture, it's fracture right here or right there, then I will definitely work with the oral surgeon. But if it's a soft tissue, just, papilla or, pink soft tissue problem, I will work with the perio. So no, there is not a specific specialty I prefer over the other. Rather, I work with all of them. And I personally don't do root canals myself. So I work with the endodontist all the time.
So that was the end of our Q&A session, and thank you so much for answering all of our questions.
Sure, of course, anytime.
And thank you everyone who have joined our YouTube live and asked questions actively. And this is the end of our session with Dr. Shin. You'll be able to find the post-webinar quiz in the WebCeph website, and it is only available for 12 hours. So keep that in mind. Thank you.
All right.